Our action item, steps in producing change. Recognition of the problem is the number one focus in producing change. Rising patient acuity and shortened hospital stays has influenced the safety of both the patient and the nurse. Finding an optimal nurse-patient ratio has become a national priority. Without understanding the problem, change cannot occur. One needs to understand the desired outcome, formulate a realistic plan to promote change, and then implementation of the proposed plan. Establishing a team of shared governance. This can include staff nurses, unit managers, executive members from hospital administration. In forming a team, it allows for the concerns of all to be addressed. Staff nurses can provide their feelings about inappropriate ratios, including increased stress levels, increased burnout, a decrease in the quality of care that they're able to provide. It also allows for staff nurses to understand managerial roles and the barriers that they face. Including hospital administrators can provide information regarding hospital resource allocation and financial constraints that staff nurses may not be aware of. By formulating a multidisciplinary team, all perspectives regarding nurse-patient ratios are addressed. Within the team, research is done using evidence-based practice and the implications of nurse-patient ratios on patient safety. This can be done using any of the reports from the IOM, NQF, the IHI, just to name a few of them. Using reports from agencies can be helpful in providing a focus on the need for change. Using this knowledge, the team can begin to formulate plans using brainstorming, addressing barriers, anticipating needs. Often during brainstorming within a team, a variety of barriers are identified that may have not been evident if a range of members were not present. Implementation and plan of change for nurse-patient ratios using evidence-based practice. Studies have shown that using a variable staffing matrix is the most effective in maintaining safe nurse-patient ratios, like staffing based on patient acuity. This also includes maintaining an adequate skill mix among RNs, accounting for varied patient census and peak times, and also use of outside employees, registry, float nurses, travel RNs to ensure that proper proposed ratios remain consistent. We need to study the effects of the implemented change. What were the barriers encountered? Was there resistance? Was there a change in patient care outcomes? Did RNs feel able to provide safer care? And is this an effective strategy to provide better nurse-patient ratios? According to the chaos and complexity theories, many changes fail despite adequate planning. And this is because hidden variables are not explored, general goals and boundaries are not developed. The act of studying the effects of change allows for adaptation based on these unanticipated barriers. Lastly, in the action item is sustaining safe nurse-patient ratios. Lobby for organizational support from hospital administration. Nurses can utilize healthcare worker unions, and then finally enlist legislative support. The ANA and its constituent and state nurses associations in the states are promoting legislation to hold hospitals accountable for the development and implementation of valid, reliable, unit-by-unit staffing plans. The ANA encourages nurses to get involved and urge Congress to support safe staffing by contacting local representatives.